Hello, everyone. Thank you for joining us today for this very important topic, the mental health impact on veterans living with kidney disease. My name is Mike Spigler, and I am the Vice President of Patient Support and Education for the American Kidney Fund. I'll serve as your moderator for today's session. The physical effects of kidney disease are generally well known, but not enough conversation happens around the mental health consequences of living with chronic kidney disease. Today, we're taking a small step towards changing that. Last year, AKF hosted a Veterans Day webinar, which featured 3 veteran panelists who had been through the kidney transplant process. In that webinar, which you can find on the AKF YouTube page, those amazing veterans shared their stories, highlighting how their mental health was impacted during their journeys, and emphasizing the importance of camaraderie through their experiences. As a follow-up to that panel, today's speakers will discuss the common mental health challenges veterans with kidney disease may experience, unmet social needs impacting access to care, and resources that can ease challenges during transplant and dialysis care. This webinar is brought to you by the partnership between the American Kidney Fund and the U.S. Department of Veterans Affairs, the VA, and the Veterans Health Administration, VHA, to promote the health and wellness of our veteran heroes. In 2020, AKF and the VHA entered into a formal national partnership that was aimed at the shared objective to increase awareness of kidney disease among U.S. veterans and to support veterans who have been diagnosed with kidney disease. Now, without further ado, I'd like to introduce today's panelists. First is Dr. Angela Giles. Dr. Giles has over 26 years of experience as a licensed clinical social worker, including 17 years of practice in the VA. She is a workflow coordinator and a behavioral health consultant for the El Paso Healthcare system. Dr. Giles works in the primary care mental integration program and serves as a subject expert in diabetes, providing screening, assessment, and interventions for veterans, caregivers, and their family members. She has been a faculty member in the Doctor of Behavioral Health program at Arizona State University for 9 years and serves as a clinical consultant for students in this program. Dr. Giles is a member of the American Diabetes Association and a provider on the ADA Mental Health Provider Directory. Next is Debbie Raphael Shanley. Debbie has over 17 years of experience in social work, clinical practice, field teaching, and community engagement at large urban healthcare facilities. In her current role as the Minority Veteran Program Coordinator, she outreaches to minority veteran communities to assess the barriers and ensure equitable access to care and benefits. Ms. Raphael Shanley specializes in helping veterans navigate the complex emotional, social, and financial challenges associated with chronic kidney conditions and dialysis. She also worked as the renal transplant social work coordinator at the University of Illinois Chicago, where she collaborated with multidisciplinary teams to provide comprehensive psychosocial assessments, emotional support, and advocacy for patients awaiting or recovering from kidney transplantation. And finally, we're also joined by Ann Schmidt. Ann is a licensed clinical social worker and has been in the field of social work for 18 years. She has worked as a transplant social worker for 17 years of these. She previously worked at Vanderbilt University Medical Center's Transplant Center with the heart and lung transplant programs. And she has now been working at the Nashville, Tennessee VA Transplant Center for almost 10 years. At the VA, she has served as a social worker for the kidney transplant, heart transplant, LVAD, liver transplant, and living kidney donor programs. She has found working with veterans and their caregivers throughout their pre-transplant and post-transplant experiences to be incredibly rewarding. Now, before we get started, I do want to encourage everyone joining to please type your questions and comments in the chat box to the right. We will try our best to get all of your questions answered during our Q&A segment at the end of this webinar. Well, I'm going to get started today, and I'd like to turn it over first to Dr. Giles to open up our discussion on mental health and kidney disease. Dr. Giles, you do a lot of work in behavioral health. Could you explain to the audience what the difference is between behavioral and mental health?
All right. Thank you for that question, Mike. Mental and physical health are equally important components to your overall health. So mental health is about how your psychological state affects your well-being, including your mood, your thoughts, and your feelings. Behavioral health goes just beyond mental health. So it looks at and addresses chronic conditions like kidney disease. And it looks at a wide range of factors. It could be substance use, your lifestyle behaviors, any stress-related physical symptoms. So essentially, it looks at how a person, how their behaviors impact their overall health. So people with chronic conditions and often experience mental health issues. So addressing both aspects through a behavioral health lens really can improve your quality of life.
Got it. Totally makes sense. You mentioned the mental health impact. We talked about it. We talked about the first webinar we had where, we had veterans talking about that post-transplant. What are some of the mental health impacts on people living with kidney disease?
So living with kidney disease can take a toll on your mental health and your emotional health due to the daily demands of managing your kidney disease, like taking medications, thinking about what to eat, or how you may feel on dialysis days can lead to feelings of depression, anxiety, irritability. Maybe you find yourself going from 0 to 60 very easily. Feeling frustrated, and sometimes having excessive worry at times. So it's normal to have emotional ups and downs from time to time, but when those feelings become more frequent or more serious, getting help from a professional can really, really make it easier for you to cope and help you to feel less overwhelmed. So it's really important to pay attention to your feelings and behaviors. Look at your motivation. Do you find that you have to push yourself to do certain things, maybe to get out of bed or even to take a shower? Perhaps you've lost interest. So maybe you're a person that enjoys gardening every morning or riding your motorcycle, but you stop doing it because you've lost interest. And you might find that you start to isolate from family and friends. Pace yourself and join a support group.
Great. Well, certainly we've talked about, CKD and other physical ailments of, affecting your mental health, but can it go the other way around? Can things like anxiety and depression actually impact your physical health?
Absolutely. So both anxiety and depression can trigger what we call cortisol, which can elevate your blood pressure, increase your cholesterol levels, and weaken your immune function over time. Think about your sleep, your sleeping habits. Insomnia, disrupted sleep patterns are common with anxiety and depression, impacting energy levels and your overall physical well being. Depression can lead to changes in your appetite. So you might find that you're overeating or you lost your appetite, potentially causing weight fluctuations and nutritional deficiencies. Also, too, with anxiety, it may manifest as stomach upset, nausea, irritable bowel syndrome symptoms, and depression can lead to also some digestive concerns. And so, also, when we think about anxiety, you may have muscle tension that leads to headaches, back pain, and other discomfort in your body. And I'd say, lastly, feeling low energy, lack of motivation associated with depression can discourage physical activity, further impacting physical health. So it's really important to remember recognizing those those symptoms that you may be experiencing and getting help in a timely fashion can help prevent further complications.
Yeah, it sounds like it's very important to kind of break that cycle so it's not just compounding over and over again. Um,
Right.
what would you want to share about the risks for veterans who are maybe experiencing mental and behavioral health complications?
Yeah, so left untreated, depression can lead to thoughts of hurting yourself or others. So it's really important. So if you're a veteran in a mental health crisis, or you're thinking about hurting yourself, or you know a veteran who's considering this, get help right away. You are not alone. Contact the Veterans Crisis Line. All you have to do is call 988, then you press 1, and it's going to give you access to free confidential support. And the hotline is staffed by health professionals 24 hours a day, 7 days a week. And anyone experiencing a mental health crisis or emotional distress can call that crisis line. And you can take some additional actions. You can call 911, go to your nearest emergency room. But please, please get help.
Yeah, it's so important to have an outlet to someone to talk to that understands, that can help. That's great that that resource is there. Um, you've been working at the VA for a while. You've seen challenges that patients have accessing healthcare. What are some of the barriers that you've observed around veterans accessing mental health care?
So when you talk about barriers, we call those social drivers of health. So those are those factors that can make it difficult for patients to access healthcare. The social driver I want to focus on today is geography. It can have an impact on your access to healthcare, especially if you live in a rural area. So the great thing, VA has really pioneered a number of telehealth initiatives that have successfully connected veterans to mental health services, which has been wonderful. And when I say telehealth, it includes telephone, internet, video conferencing, email, and text messaging. So thinking about these technologies, they're very important, of course, for those veterans living in rural areas, but also for those veterans who may be homebound due to illness or disability.
Great, thank you very much. But I know that you mentioned some, crisis resources, which I know the team has dropped in the chat as well. But what about kind of those maintenance resources, those self-care resources that can help patients, or tools? Could you talk about what you share with your patients to help with that?
Absolutely. So there are three major resources that I like to provide patients. The first one would be smartphone mobile applications for veterans. So there are more tools than ever before to really support your mental health. Patients can now complement their care with mental health apps. It can help manage stress, manage any depressive symptoms, anxiety, and you can learn mindfulness skills that help with relaxation. The next resource that I like to give patients is what we call the Veterans Training Online Self-Portal. So it really helps you overcome everyday challenges. The great thing is that the courses are free. It's available 24 hours, 7 days a week, and it's 100% confidential. So it helps you with challenges related to sleep. You can set your own sleep schedule. You can make some modification to your sleep behaviors, and you can even start a sleep diary.
Wow.
Also, yeah. So it also addresses problem-solving skills, anger management. So it can help you deal with situations and people in a better way. And then also parenting resources for communication and stress. And then lastly, I would mention whole health. So that's VA's approach to healthcare. So it really empowers the patient to really take charge of their health and live life to the fullest. So with our website, VA website for whole health, you'll find podcasts, whole health videos, and libraries that have handouts and other helpful tools.
Fantastic. Well, thank you very much, Dr. Giles. If you're just joining us, welcome to our webinar on the mental health impact on veterans living with kidney disease. As a reminder, we will take questions at the end of our time today, but you don't have to wait to put them in now. You can go ahead and send them to us. Just drop them in the comment section, and we'll try to answer as many as we can at the end. But now let me come over to Debbie. And Debbie's going to be sharing her experience as a VA dialysis social worker and some of the mental health stressors she sees during dialysis care. So Debbie, let me pose my first question to you. When does someone with kidney disease consider dialysis? What are the main dialysis options that veterans have?
Well, ultimately, the decision to start dialysis involves discussions between the veteran and their healthcare team, considering their overall health, quality of life, and personal preferences. Dialysis is typically considered for individuals with kidney disease that are at a severely reduced capacity. In most of the cases that I've seen on the dialysis unit, most of them are at end-stage renal disease, also known as ESRD. This is when kidney function declines to the point where waste products and fluids build up in the body and can cause health complications. Dialysis is a treatment option that artificially removes waste products, excess fluids, and electrolytes from the body when the kidneys aren't able to perform these functions effectively. So There can be times when there is a need for acute kidney dialysis, such as fluid overload, electrolyte imbalance, and other health complications. So what are the main dialysis options, you ask? Well, there's in-center hemodialysis, which involves going to a center 3 times per week for anywhere from 3 to 5 hours. This involves diverting the blood from an access site, a catheter or fistula from the body, into a machine that will filter out waste products before returning it back to the body. The hemodialysis center really operates on what they call a shift and chair time. Hemodialysis treatments run Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday, and they typically offer early morning shifts starting at 5 to 6, midday shifts, and evening shifts to accommodate patient schedules. Now, another dialysis option is peritoneal dialysis, also known as PD. So this is called home PD. It is performed manually or with the help of a machine. Now, this differs from hemodialysis because this method introduces a special fluid into the abdominal cavity through a catheter, and the peritoneal membrane acts as a filter to remove the waste and excess fluids. Another option is home hemodialysis. This is done in the home with a dialysis machine and again involves diverting the blood into the machine to filter out waste products. These are the options that we have.
Great. Well, and our team at AKF, we've also developed a home dialysis decision aid that can help you look at those different options and determine what's best for you. And, I think the important thing too is, if you start in one, it doesn't mean you can't switch to another kind really as well. So, but thank you very much. It was a great description of the options. As a dialysis social worker, can you just describe kind of what your role is at the VA dialysis clinic?
Sure. Dialysis social workers play a vital role in enhancing the well-being of the patients by addressing the psychosocial aspects of living with chronic kidney disease and helping them navigate the complexities of their treatment. Every dialysis center is required to have a social worker. So let's start from the beginning. Dialysis social workers assist veterans with dialysis placement. Now, that could be at a VA dialysis unit, a community care dialysis unit, dialysis even at a skilled facility, or other treatment options. Next, we can provide emotional support by providing supportive counseling to patients, their families, to help them cope with the challenges of kidney disease and the dialysis process. Resource coordination, assisting with patients in accessing VA resources or community resources, financial resources, and support groups. Patient advocacy, to advocate for the needs within the healthcare system to get appropriate services. I like to give an example for this one. I think about one of my dialysis patients. Let's just call him Mr. Jones. Mr. Jones started dialysis and he really enjoyed being on the Monday, Wednesday, Friday shift. He liked to be there at the 5 a.m. shift time because it gave him a sense of structure, a sense of purpose, a sense of schedule. As time went by, after a few months, Mr. Jones realized that driving to dialysis and then doing the dialysis treatment made him very tired. So as part of my patient advocacy, I would meet with the multidisciplinary nephrology team and see how we can get Mr. Jones safely to dialysis while meeting his needs. We came up with this idea that Mr. Jones's wife works until 2 o'clock. So as an advocate, I helped to move Mr. Jones to a 2 o'clock chair time so that his wife could drive him. This is an example of patient advocacy. Education. Continued education for patients and families about treatment options and the importance of adhering to medical advice. And lastly, I like to leave this one for last because I think a lot of people don't realize that part of being on dialysis, you can also travel. It doesn't mean that you have to stay at your home dialysis unit. At the VA dialysis unit, we can make referrals for transient or travel dialysis. I have a lot of veterans who are snowbirds or like to visit their family or try to get out of the cold weather in Chicago. So what I would do as a dialysis social worker is help them find a safe place to dialyze, whether it's at a VA or at a community care option, to send them there while they are on vacation and receive dialysis. We work with the medical team at the receiving facility to make sure it's a seamless handoff. Another example I like from a VA perspective is I had a veteran who was enrolled in the foreign medical program. We were able to get him to receive dialysis out of the country. So those are some of the examples of my role as a dialysis social worker at a VA dialysis unit.
That's a lot. I mean, you guys are really kind of like the quarterback of care for these patients, and it's really important work that you do. And just listening to all that, it's no wonder that social work is always listed as one of the most stressful jobs. You have so many things that you're doing that are important for patients. So thank you for what you do. Could you talk a little bit about, you heard Dr. Giles talk a little bit about broadly some of the mental health challenges of kidney disease. What about specifically in dialysis? What are some of the mental health challenges you see for dialysis patients?
Well, dialysis really faces a wide variety of mental health challenges due to the physical, emotional, and lifestyle impacts of end-stage renal disease. Imagine someone going to in-center dialysis and having to spend about 15 to 20 hours a week getting to and from treatment and understanding some of the dietary restrictions. So some of the things that I see working from a dialysis perspective is feelings of loss. Dialysis patients really may experience grief related to the loss of their previous health, lifestyle, or independence. Adjustment disorders, coping with the chronic nature of kidney disease and lifestyle changes required to adjusting can lead to emotional distress. Fear of complications. The fear of complications sometimes happen because of risk of infections or problems with the access site. And this can lead to increased anxiety and stress. Isolation. Sometimes patients feel isolated from their friends and family, particularly if they're unable to participate in social activities due to their treatment schedule. Stress. Well, the demands of the regular dialysis session, as I said, three times a week, 3 to 5 hours, can cause significant impact and stress on a veteran's outlook. Body image issues. Whether it's peritoneal dialysis or hemodialysis, a catheter or fistula will have to be placed in your body. Some people feel self-conscious about this, which can cause stress. Additionally, sometimes people gain weight when they're not adhering to their diet, and this can cause body image issues. And of course, concerns over anxiety and depression with all of the demands that dialysis has.
That is a lot to deal with, and I know that body image issue is something. There's a patient group in Brooklyn that I love, and each year they have a patient conference. They do like a fashion show where they show off, their access point just to try to like destigmatize that a little bit, and it's really great. So I'm really glad you brought that up as well. What are some common resources that you share for those that are experiencing challenges related to the dialysis?
Well, we talked about this a little bit earlier about the VA being such a large healthcare system. When I think about resources, I use this as an opportunity to remind people about the VHA PACT model of care. So this is a patient-driven, proactive, and personalized team to help veterans with their barriers and to enhance the quality of life. P is for patient, A is for aligned, C is for care, and T is for team. It's a partnership between you and your healthcare team to help you meet your individual healthcare goals. This healthcare team consists of a primary care provider, a nurse, a social worker, and medical support staff. You are at the center of this team, but it also includes your family members, caregivers, or other supports. So with that in mind, when I think about a dialysis patient, I think about this PACT model, and I also think about the multidisciplinary team model that's on the dialysis unit. You have a multidisciplinary team of a nephrologist, your dialysis nurse, your dialysis social worker, your renal dietitian, and your dialysis technician. So the most important resource I remind people is to remind them about all these people here to help you. Communicate with your PAC team and your dialysis multidisciplinary team to access the resources you need. And the VA can offer things, if eligible, from beneficiary travel, homemaker services, home care, primary mental health services, caregiver support, and other community resources. So when I think about resources, I really make sure to remind people the number of people and the multidisciplinary teams that they have working for them and to outreach to them so they can access the many resources that the VA has to offer.
Great. Well, thank you very much, Debbie. A reminder for everyone, if you have questions, we'll have plenty of time at the end. You can drop those in the chat and we'll answer them. But now let me turn over to Anne. Anne, you are a VA transplant social worker. And for those who may be listening to this who have kidney disease or a loved one with kidney disease and you're just learning about transplant, I'd love if you could talk to them a little bit about the process, starting with first, at what point are people referred to transplant?
And it is very much a process. Yeah. So the transplant process really begins at the VA by the veteran's home VA completing a packet to be submitted to VA central office. So usually the veteran's specialty provider, which is often the kidney doctor, at the home VA determines transplant is a potential treatment and begins required medical testing and psychosocial evaluations. And once all this testing and assessments are completed, it's all submitted in a packet to a VA transplant center. And this can be submitted for consideration for transplant at a VA transplant center or a VA community care for transplant within the community. Or it can be submitted for both, be considered at both VA transplant center and community care for transplant. So a VA transplant center will review this packet, determine if the veteran is a potential candidate for further evaluation at a VA transplant center or a non-VA transplant center under VA community care. And the decision for a veteran to be listed is made by the transplant center after a more thorough evaluation. So this includes testing and assessment by many different specialties. So a surgical assessment, medical, psychosocial assessment, and then if appropriate, the veteran will be approved and listed for transplant through UNOS, which is the National Transplant Waitlist. Veterans do have an option of being waitlisted at 2 different VA transplant centers or 1 VA transplant center and 1 VA community care transplant center. So it's important to talk to your home VA kidney doctors about what transplant centers might be good options for you. So this could be based on medical need or specialty care that you might need to look at a very specific transplant center that has a specialty care for that. Or you might want to consider, where's your social support the greatest? Where do your caregivers live? Is there a center near you that would be a good option for you? So there are 10 VA transplant centers around the country that support kidney transplant. Many are part of teaching universities, medical centers. So for example, the Nashville VA Transplant Center is part of Vanderbilt University Medical Center's transplant program. So 38 of our veterans had kidney transplants at Vanderbilt this year. So there's a lot of different ways that you can learn more about VA transplant centers and really any transplant center around the country. There's a lot of public data that you and your doctor can review and discuss. And a good way to learn more about that is through the Scientific Registry of Transplant Recipients. So this is SRTR, and it analyzes reported data from the Transplant Procurement and Transplant Network. And it's all reported data about transplant programs and organ procurement organizations all around the country. So every program has to publish their transplant outcomes and statistics. So that's a really good website for SRTR to just learn about any program you might be interested. What are their outcomes? Another good way to learn more about transplant outcomes and wait times is UNOS website. So UNOS is United Network for Organ Sharing. So they manage the wait list, and they have a lot of data on their site about transplant in general, resources for transplant recipients, and living kidney donation information. So UNOS website is also a good place to learn more about that.
That's great. And, ACAF recently put out a transplant toolkit to help patients understand all of the things that go into this process and preparing. I mean, even up to the point of, being ready when you get that call to be able to go. And also multi-listing. I mean, if you're in different regions, you can be listed in multiple locations as well, which I think
up your donor pool. Absolutely. Yeah.
Yeah, absolutely. Okay. I wonder also, specifically for veterans, what are some of the transplant options?
Transplant options it really is, a good conversation to kind of have within, with your doctor to try and figure out, which option is best for you. Is it best to think about going through the VA? Is it best to think about going through community care? Is it best to think about dual listing? Is it best to kind of focus on listing at one center? So I think that's a good conversation to kind of have ongoing with your provider and with the transplant centers. And I think most transplant centers, they'll be really honest with people about, their recommendations of, do they recommend dual listing, or do they recommend that you go to a center that has a different specialty maybe than theirs for kind of whatever you might be needing.
Great. And I assume you all also help with, living donor transplants as well. So not just deceased donors as well, but the living donors.
Yes, I do. So yeah, and that, for anyone that might be interested in, kind of finding out more about kind of the first part of that is to be active on a wait list at a transplant center. So, that's kind of the first step for you to be active on a wait list for a transplant center. And then that center, if you have an identified potential living donor, will do a very similar assessment to the one that you had gone through to see if your potential living donor would be a good match for you for living donation. And that benefit would be, covered under your VA benefit, regardless of that person's, insurance coverage. All of that assessment, the surgery, the care for a potential living donor would go under the recipient's care.
Got it. And so you talked a little bit about, your work kind of in the preparing for that. What about, as the transplant's happening after transplant, what does the transplant social worker do, in those two stages?
Yeah. So really, it kind of does start with that evaluation of us really, trying to get to know people during the evaluation. And, for our psychosocial assessment is a big part of that. And it's something where, we do want a good continuity of care. We want to get to know people. We want to try and identify potential barriers, for going forward with transplant. So some of that, would be us already having an established relationship, learning about, kind of what's their plan for their caregiver team. Who's going to be the person helping them out? Is that person working? Does that person have a lot of other responsibilities? Kind of, what arrangements, need to kind of be prepared for that. Is the veteran still working themselves? Have they explored disability, service connection? Is the caregiver still working? Does that person have FMLA? Do they have paid leave? So, kind of pre-transplant, we want to go ahead and have a good understanding of what the anticipated plan will be for caregivers, employment, financial plan, a good mental health history, so we can kind of, again, be proactive for all those things, a good understanding of any substance use history, so we can kind of work on goals for that, help with referrals for like smoking cessation, rehab programs, good understanding of how prepared are they for the compliance of all of this. So compliance for appointments, meds, diet, and kind of who's going to help them with that. So when it's time, for the transplant episode, we've kind of got a good rapport with people, and then we're there to sort of support them. Because really, as best as we can with all these, intentions and plans, life is going to happen and we don't know when the transplant's going to be. So it is something that, even though we've made all these plans, the plans might change, and that's okay. So, kind of part of the social work role during the transplant episode is to just kind of be there, be available for our veterans, for their caregivers, as things are kind of changing. You might need to swap your caregiver. You might need to have your backup caregiver help you out. You might have unanticipated financial changes, work changes. Maybe, your caregiver thought for sure that they would have enough banked leave, and now that's maybe changed because of pre-transplant illness. So the plan is kind of always changing. So a big part of our job is to kind of work with that. Also, relationship issues. You're going to be away from home probably for at least a month at wherever the transplant center is. So that can be incredibly stressful. Kind of support for ongoing avoidance of substances, managing, anxiety, depression, mood swings, and also kind of helping people navigate VA transplant benefits. So part of the VA transplant benefit, regardless of your service connection, would be travel and lodging. So travel to and from the transplant center, the VA transplant center, for our recipients and their caregivers. So helping kind of make sure that that travel's going well, local lodging while people are here, for their transplant. Most VA centers contract with local hotels that are covered by the VA for people to stay locally if medically required for their transplant for, a month or more. It's really however as long is required. So kind of helping with that. And then long term, this really is a good continuity of care for like a healthcare model for transplant. We really do follow people lifelong. So, kind of staying with people as they're navigating this post-transplant, kind of world. People are always going to be high risk for rejection and infection. They're going to have frequent follow-ups. For most of our kidney patients, they're going to have follow-ups every 3 months the first year, and then annually. So, that is still a big commitment lifelong for veterans and caregivers, especially if you're thinking about trying to return to work, your caregiver returning to work, kind of are you navigating returning to your own independence, taking ownership of your care again? Because for a period of time, people are definitely going to need help with managing their transplant, but then we want people to be, back to managing it for themselves again. Also, too, there's always that potential of a rejection. Sometimes people have to have a second transplant. So kind of helping people with that part of it. And a lot of people are very interested in, are they able to reach out to the donor family? And you can. So that's another big part of the social work role of helping people write a letter to the donor's family, kind of opening that door for communication, potentially, having much more interaction with them. And that can be a very, emotional process. So working with families and our recipients for that.
Right. Are there any specific resources that you commonly share, to help individuals navigating all those things you just talked about, even after the transplant? I think a lot of people think, okay, I've gotten the transplant and, it's a magic cure. And we always say it is great. It is probably the best treatment for kidney disease, but it is still a treatment. It is not a cure. So, what are some of the resources that you share for the folks?
I think that's a really good way to focus on it of, this is a treatment. So just like, people have learned over a long time of how to handle, their kidney disease, now people are going to have to learn how to manage their transplant. So it is suddenly like, kind of managing this whole new set of needs. And it's, some of these things are very similar to, what you've managed before, but it's just new pieces of information. So I think, kind of like what our other two speakers had focused on of, your home VA is going to have a lot to offer you for local mental health services, peer support groups. A lot of people have talked about whole health, and I feel like that's something that most of my veterans are really interested in. I've had one of my veterans and his wife, they took a cooking class together with whole health to kind of focus on good nutrition afterwards. I've got a veteran starting art therapy next week. I have a veteran, he's been part of the music therapy program for a year. He has a guitar, he's getting quite good. So it is, definitely a lot of options within the VA. Also thinking about return to work too. So return to work programs within the VA. I've also got, very specific transplant support groups, just kind of trying to find people with shared experiences that, might be able to offer support. Because like you said, people think, well, it's done, you've had the transplant, but it is a lifelong commitment and lifelong care. So it is helpful if you can find some, people that do really understand kind of what that means of lifelong kind of, living with this need. And I think also I encourage people to find ways to give back post-transplant. I have a lot of our veterans that are ambassadors for Donate Life programs. They speak at events all over the country for organ donation awareness. They're the best ambassadors we will ever have for people signing their donor card. So encouraging people to do that. There's also the Transplant Games of America, the Transplant Olympics. So, I've encouraged a lot of people to do that. It's a great way to set new goals for yourself in your new healthy transplant life.
Great. Well, we did have one question that came in, and it's in your realm, so I want to ask it. If you're going through the process and it's determined that you're not a good candidate, right? There's lots of reasons for that. An active infection, maybe an active cancer or something that just wouldn't be safe for the anti-rejection medications. Can you talk about that? Like what happens? It's not a no forever, I assume. It's a no for now, but I wonder if you could talk a bit about that.
It's all very different. So I think, whenever someone is going through the evaluation process, there are all these different, again, surgical, medical, psychosocial criteria. So we kind of look at all those individually. And sometimes it may be something where we might have a bit of a to-do list. So whatever that might be, whether that means, people need to work on quitting smoking, people need to work on getting stronger, people need to have different consults to, work on other perhaps like medical barriers. If we need to loop in other members of our team for Maybe someone needs, more of like a cardiac consult, different consults for different clearance. So sometimes, we do have people who throughout this process where they do have a bit of a to-do list, and it's working with them to set, to see, are these goals that we can work on, or if they're goals that can't, we really think there's an absolute contraindication to transplant, then your team will be honest with you and say that, you may not be a candidate at this program, you might be a candidate at another program. So oftentimes, if people are not a candidate at our program, we might work with them to try and help them find another center where they can be evaluated and see if that might be an option.
Fantastic. Well, Anne, thank you so much. I'll come back to you for the Q&A segment in just a little bit, which we will start very soon. Please continue to type your questions and comments in the comments section, and we will answer as many as we can. Before we go to that, I just want to talk a little bit back to the partnership that AKF and the VA have together and talk about some of the resources we've built together and some other AKF resources that I think will be helpful to those listening. So now that we've heard from our VA mental health experts who have shared their resources, let me talk a little about some of the AKF ones. So first, we're very happy to have some resources specifically designed for veterans who are navigating a life with kidney disease. Our team is going to link a few of these in the comment section in the chat as we go. But first, we have an overall web page, a landing page for veterans that come to the American Kidney Fund website to learn about all these resources. You can find almost all of these resources I'm about to talk about linked from there. But where you'll find on there are things like some one-page educational documents on managing kidney disease, benefits that are available to veterans that are living with kidney disease. And we also have several previous virtual events recorded and available that are linked from our YouTube page, the AKF YouTube page. First is the webinar I mentioned at the beginning, which is the impact of camaraderie in the kidney community, which is a special we did for Veterans Day last year. We've also had some great VHA speakers as part of our Kidney Action Week, which is our virtual patient conference that we do every year in March, which is Kidney Month. We had a VHA and AKF coffee chat where we had Assistant Undersecretary for Health for Clinical Services, Dr. Scavella, and our President and CEO, LaVarn Burton, speak. We have a session that we've done for veterans on kidney disease and diabetes. If you don't know, diabetes is the #1 cause of kidney failure, so it's really important to understand that aspect of things. And while a couple of these other resources, educational resources on the American Kidney Fund site, are not specifically designed for veterans, these are really useful tools for really anyone. First, we have a program called Know Your Kidneys. You can go to that site and you can put in your information. So if you have risk factors for kidney disease and you've had a recent test for your kidney health, you can put in all those lab values. We really stress there's 2 great tests for kidney disease. The first is a urine test for protein. Your doctor may call it UACR. And there's also a blood test for eGFR, which just measures how fast your kidneys filter your blood. But you can put all that information in, and our tool will give you kind of recommendations for next steps, what your risk factors are. And then there's also our Know Your Cause site, because it's one thing to know you have kidney disease, but it's also extremely important that you know what caused it. Diabetes is the #1 cause, but there are a lot of rare diseases that there are now treatments available for, clinical trials that may have genetic components. So it's really important for your family's benefit and others to really know what caused your kidney disease. Not all kidney disease is the same. And we also have a Kidney Kitchen website as well with hundreds of recipes on that site. You can search, I want breakfast, lunch, dinner foods, snack. I want to control for potassium, for phosphorus. Every single one of those recipes on our site has been created by a dietitian. We even hired a chef to make sure it actually looks and tastes good when you do it. We don't want you to make one recipe and never come back again. So lots of those. It's all free on our website. You can even work with your dietitian to create a meal plan from the site. And also, if you're looking to give back, Anne just talked about post-transplant patients. If you're looking for something to do, certainly we have an ambassador program, but you can also become a kidney health coach. It is a free training program that we have on our site. It takes about 2 hours to complete, but then you are empowered to go out into your community, to your local library, community room, your church, whatever it may be, to give a very simple talk about the risks for kidney disease and how to get tested. So it's all free. Our staff supports you through the process, gives you sample presentations. It's really, really great. And then, certainly from an education standpoint, the kidneyfund.org site has lots of resources, but we're also there if what you really need is just a hand up from financial assistance. Because living with kidney disease can bring, as you heard from everyone today, really bring increased financial expenses and put a strain on someone's mental health as well. So we have 4 programs I'm going to quickly talk about. The first is our health insurance premium program. So if you have a private insurance plan, or you're on Medicare and you have Medicare Part B, if you financially qualify, we can help pay for those insurance premiums for you. We also have a safety net grant program. It's a small grant, depending on what part of the country you're in. It's between $200 and $250 once a year, but it's to get you over a hump, right? It's to pay for an unexpected copay, to get a minor car repair, buy a public transportation card, whatever it may be. Those grants are available as well, and you can get them, once a year, every year. And something that we've just closed, but we certainly were very active, is disaster relief. We just had the biggest geographic area we've ever had to turn on following Hurricane Helene, and then followed right behind with Hurricane Milton. We gave out about $350,000 in grants to patients affected in those areas. If you had to leave to evacuate, or you've lost food or medications, those grants can help with that. And then finally, for those of you who may be listening in Massachusetts, New York City, Washington, D.C., Maryland, or Virginia, we also have a living donor assistance fund. So if you have a living donor that has out-of-pocket expenses from missed work or travel for evaluation, we have a reimbursement program that helps with up to $2,500 to those living donors. We hope to expand it to one more area next year at a minimum, and are continuing to do that. But all of those programs, to apply for any of them, either you or a member of your healthcare team, add one more thing to the list that social workers too can do that for you as well, can go to gms.kidneyfund.org, set up a profile, check your eligibility. Anything that you're eligible for will pop up. You can see and apply for. Our turnaround time is pretty quick on doing that should you qualify. So we welcome those opportunities. And just, more broadly, these are not just AKF. We really want to help whatever we can. The team will drop some of these links in the chat as well. The National Alliance on Mental Illness, NAMI, has some great resources available. You heard about the 24/7 Veterans Crisis Line. That one's veteranscrisisline.net to learn more about that one as well. There's veteran caregiver support. So if you're watching this thinking about someone that you're caring for, there's a caregiver support line where you can learn about some of those resources. It's available Monday through Friday from 8 a.m. to 8 p.m. Eastern time. That number, which we'll drop in the chat, is 1-855-260-3274. One of our peer organizations, the National Kidney Foundation, also has a peer-to-peer program called NKF Peers. And then there's lots of virtual support groups out there. Even if you think you have a rare disease and there's no one out there that has that, you would be surprised what you can find on places like Facebook, through some of your transplant centers, through your social worker, for some of those resources. So let's go ahead and let's bring everyone back on, and I'm going to turn to some questions from the audience. We've gotten a few in. Let me start with Dr. Giles. Let me come to you first. I'm a care partner, and I've noticed my loved one being overwhelmed and stressed often. What are some recommendations that you can provide or resources you can share to help them manage these feelings if they're being reluctant to seek help?
All right. So if someone is struggling with their feelings and is a little reluctant to seek professional help, you can try a number of things. First, I would encourage you to listen. Let the person talk about at their own pace, and respect what they have to share. Be patient. So let me say that one more time. Be patient. Let them set the pace for seeking support. Be empathetic. So not feeling sorry for a person, but putting yourself in their shoes, right? So letting them know that you understand that they're having a hard time. Reassurance. So let them know that you're there to help and that they're not alone.
Great.
Also, offering practical support. You know, have a time where you're not talking about chronic kidney disease. Make time for fun, relaxation. I think that's also very important. And you may provide feedback to that loved one about certain signs that you spot in terms of signs of stress, and help them to identify that. And then also, finally, again, gather as many resources as you can. Mike previously talked about a number of resources today, specifically NAMI. I wanted to really emphasize that. That's that National Association of Mental Illness, because it has a support groups locally and nationally that can provide support. Again, the crisis line, and also the American Kidney Fund. So those are a number of tools and different ways that you could help a loved one.
Fantastic. Thank you very much. Debbie, talk a little bit about your role as Minority Veterans Program Coordinator, and how does the VA tailor their approach to providing care to minority communities?
Excellent question. Thank you for that. So the VA has the Center for Minority Veterans. At every VA, there is me. Role is to make sure that we are going out into these communities, providing resources, education on healthcare navigation. And myself, as a former dialysis social worker, I make sure I go to all the dialysis clinics in our area to let them know that I am a point of contact to help veterans at their dialysis center navigate the healthcare system, or at least at the VA if they have any questions. Additionally, I really just try to make sure that I'm working with a lot of the local nonprofits that work with veterans, and making sure that we are creating visibility, we're creating a presence, and we're building trust in these communities. I think sometimes a lot of people have distrust in federal healthcare organizations, but my role as a Minority Veteran Program Coordinator is to make sure that we are outreaching and we're going out and getting them the resources they need, providing points of contact. And I think most importantly, making sure that they know how to navigate the healthcare system. The VA is very big, and as all of my colleagues have talked about today, there are numerous resources. So learning how to navigate that. Today I talked a lot about acronyms, and making sure they know what these acronyms are and how to ask the questions, how to ask for help, how to know where their clinic is. Sometimes even walking into the VA, it's a lot of stuff. And when you're not feeling well, just knowing that someone's there as a point of contact, a minority veteran point of contact, is helpful.
Yeah, I've never experienced a disease state. I've worked on a couple different ones with kidney disease, with the number of acronyms that exist. And so much so, when we have new staff members start here, we give them a whole sheet on different acronyms and what they mean. So that's a really good point. Anne, a question for you. As someone who just had a transplant, I feel overwhelmed with many of the new changes. How do I know whether I'm experiencing depression or just overwhelmed with all the adjustments? Who should I contact?
So that's definitely something your transplant team can help you with, especially the transplant psychologist and social worker. And I think it's something to, kind of talk about and explore more. And this is also why, during the pre-transplant phase, we get a good history of mental health. So again, we can kind of, try and work on being more prepared to manage symptoms post-transplant. Because post-transplant, changes in mood can be part of the challenges of immunosuppressants. So many people have to take a medication called prednisone, which is a steroid, which can cause mood swings, increased appetite, weight gain, insomnia. So there can be a lot of different things that are going on within your body, with the meds, with stressors, all those different things. So it is something to work with your transplant team to kind of, work through that and figure out, what can we do to kind of work with you to manage some of those symptoms and make a good plan for it.
Fantastic. So I think we have time to go around and just get maybe last thoughts from everyone. Dr. Giles, will start with you, but thinking about, for our audience, what is one message that you'd like to share with them on how to manage their mental health on top of everything else that they're managing with kidney disease?
Okay, so it's important to remember that your mental health is just as important as your physical health. Don't hesitate to reach out for support from loved ones, a therapist, your healthcare team. Again, that crisis line that we spoke about earlier. and actively participate and practice self-care activities that bring you joy. I think that's really important to remember.
Thank you so much. Debbie, let me come to you for final thoughts next.
Final thoughts. So, Dr. Giles had really summed up a lot of things, but just, I hoped when I was talking during my part, I wanted to show people how many different teams of people you have here to collaborate with, to work with, to remind them that there's that level of support within our VA healthcare system. And then lastly, just education and awareness of mental health. I think sometimes it's important for us to know that even providing education for dialysis technicians who work with dialysis patients 15 to 20 hours a week to see what the signs and symptoms are of depression, anxiety, adjustment disorder, so that they can also outreach to mental health care professionals. So those are the two important things. Mental health care is healthcare. You have a team working for you at the VA, multitude of people, and just education awareness that, mental health is very important and is really profoundly impacted when you have a chronic illness.
Thank you very much, Debbie. Anne, what's your final message to the audience?
I guess just to, remember, especially thinking about transplant, that, the transplant experience will be unique to you. We talk a lot about, kind of the average experience, but everybody's is going to be unique regarding, how long the wait time might be, the post-op recovery, long-term recovery. So just remember to have good support with that. And I think, it's okay to try out different kinds of support. Try going to see a therapist, try a support group, but just try some different things to find out what's going to be helpful for you.
Great. Well, I want to thank all of you. I want to thank all of you for tuning in today. I want to thank the VA for their partnership with the American Kidney Fund. It has been so beneficial for all of us. And again, thanks to the audience for tuning in. As the webinar starts to end, please take a minute to fill out a survey that'll pop up and tell us how we did. Your feedback is super useful for us as we plan future sessions, and we really listen to everything that people leave for us. So visit the kidneyfund.org website, check out our resources, please fill out the survey, and we'll see you next time. Thank you, everybody.
Thank you.